The Office for Civil Rights at the U.S. Department of Health and Human Services has helped resolve 2 religious discrimination complaints, ensuring clergy access to patients for religious purposes during the COVID-19 pandemic. Joining me now on Skype to talk more about this is Roger Severino, Director of the Office for Civil Rights at the Department of Health and Human Services. Roger, welcome back. Thank you so much for your time today.
Thank you. It's a pleasure.
Well, first off, let's talk about the first case. It involves a mom who was separated from her newborn son in the hospital, and she asked for a Catholic priest to be allowed in to baptize him. Unfortunately, that request was denied because of a visitor exclusion policy that was adopted in response to the COVID-19 pandemic. Can you talk a little bit more about that case and how your office was able to help?
It was a sad situation, and you can understand why hospitals want to do everything they can to keep people safe. But as we try to save as many lives as possible, we can't forget what people live for. And for many people, it is the exercise of their faith, especially in crisis situations. So a mother was separated from her newborn child because of the risk of passing along COVID and was not able to have a priest come out to administer the Sacrament of Baptism, which was incredibly important to the family. My office, the Office for Civil Rights at HHS, enforces conscience and religious freedom laws, and we got in contact with the hospital, examined their policies, and were able to reach an accommodation that balances safety with religious exercise. And this is now our 3rd resolution, and I'll mention the second one in a second, where we have balanced safety with the ability of people to exercise their faith even during COVID-19. You don't have to sacrifice the body for the soul or vice versa.
Hey, Roger, you mentioned other cases. The other case I want to talk about involved the Sacraments of Holy Communion and the anointing of the sick to a COVID-positive patient. Tell us about that and exactly what happened there.
Similar circumstance. This was unfortunately an end-of-life circumstance in this case. It was close to the point of death. And for many Catholics, of course, they want extreme unction, the sacrament of what some people call last rites. And we found out that you can allow people in and keep people safe. So once again, we intervened, reached a resolution with the healthcare system so that they're going to allow religious visitations. Now, clergy will have to do the proper precautions, wear PPE, in one case receive training, make sure that they follow infection control protocols, but they will have reasonable access to administer the sacraments, whether it be communion, confession, extreme unction. And it's not just for Catholics, it's for any religious believer who wants access for spiritual support. We have to treat people as an integrated whole, their mind, their body, and soul, all of it come together to fulfill the true picture of health. Even during a crisis, we could balance all these issues, and we're so happy that we've been able to accommodate these religious visits. Too many people have been literally dying alone, and now that we've learned how to keep people safe during this crisis, we're seeing that hospitals are responding and changing, and we hope this serves as a model for other hospitals around the country to follow.
Well, Roger, these policy updates will now benefit other families in these very difficult situations and really underscore the necessity of balancing health concerns with spiritual support. Can we talk a little bit more about that?
Well, this is the most pro-life, pro-religious liberty administration in history, and we've mobilized the entirety of the federal government to address the COVID crisis, and that it involves every aspect of the human person. We had a case, for example, of a medical student who was prohibited from continuing his residency because he had a beard, and there were questions about the fit of the mask. You don't want to sacrifice a person's ability to help save lives when you could find an accommodation. In this case, it was an accommodation of a mask that allowed for beards. And again, people's religious beliefs, some people have restrictions on grooming, etc. We can find accommodations where it's win-win. And because this administration has been the most pro-religious liberty in history, we've been finding the way, even during crisis, to make sure that no civil right is left behind, whether it be disabilities or religious freedom.
Roger, we don't have a lot of time left, but I do want to ask you this last question. For people who may be in the midst of maybe a similar situation and don't know how to navigate the best course of action, what would be your suggestion?
Speak to the hospital first, see if they will provide an accommodation. Show them these resolutions. You could find them on our website, hhs.gov/OCR. And if you don't get a resolution, file a complaint with us, hhs.gov/OCR, if you believe your religious freedom rights are being infringed.
All right, Roger Severino, Director of the Office for Civil Rights at the Department of Health and Human Services. Thank you so much.
You're welcome.